Hi, welcome to CT Chest Review at www.ctchestreview.com. This is Dr. Bhavin Jankaria, and here we're on 112th case, and we've come a long way, right? Almost 4 years now. And there are some things, which I haven't addressed. I once did a post in 2011 on the scab sign, but for some reason, and this is such a common entity, I've never really addressed a fungal ball in a cavity, and that's so simple. Now, this is a 32-year-old known to have TB in the past, one episode of hemoptysis, and you can see these post-infectious changes. That's what we call them: fibrocystic fibrocavitary lesions with volume loss in the right upper lobe. You can see that really well on the coronal images. The new terminology for this, and I'm going to do another extended post in a few weeks on this, is post-tuberculosis lung disease. And that's the terminology to be used, with the understanding that PTLD is a substrate for aspergillus related lung disease, and I'm coming to this. And I've started this new series called Case of the Day, where from Monday to Thursday I post a case that I have reported the same day. And so I did this 2 weeks ago or 3 weeks ago, case 3 for PTLD and query reactivation. So you can check that out if you want. It's only on YouTube. Now, 5 years later, at age 37, the patient came back with multiple episodes of hemoptysis. And now you can see there is soft tissue within the larger cavity extending into one of the other smaller cavities. And these are the post-infectious changes. So there's PTLD. And on top of that, we have a fungal ball or mycetoma. And we did prone images to show that the lesion was mobile and shifting, though you don't need mobility to make a diagnosis of a fungal ball. And for many years, this was good enough until a few years ago, these terminologies cropped up: CPA, CCPA, CFPA, CNPA, and it really is a little confusing. So, what are these terminologies? Um, Fungal ball in a cavity comes under the umbrella label called CPA, or chronic pulmonary aspergillosis, which is different from ABPA and which is different from aspergillus infection that occurs in immunocompetent and immunocompromised individuals in the parenchyma. CPA is 5 categories: single cavity with a fungal ball, CCPA, which is chronic cavitary, CFPA, which is chronic fibrosing, then you have the chronic necrotizing, and an aspergilloma nodule. And all of these can intersect and interact with each other, and CCPA is kind of in the center. Simple cavity is with aspergilloma is when a person has a single cavity. Maybe it's the result of a prior abscess, a prior hydatid cyst, something, and lands up with a fungal ball within. And there are these two cases, this one here and the one here. This is in a bronchiectatic segment. So you need a predisposing factor that is required, because you need a cavity or a cyst or something within which the fungal ball can happen, where there is aspergillus infestation and then growth of that fungal ball. And you can see this here. And again, we diagnosed this because I had biopsied this. And so, that's how we know that these are simple aspergillomas within single cavities. CCPA is the commoner one, and this is exactly like our patient where you have multiple cavities and then a fungal ball. The definition of CCPA is one or more thick-walled cavities with a fungal ball, but there's a lot of pericavitary fibrosis, some opacity, some pleural thickening, etc. Here's another patient who has PTLD and then this fungal ball which is mobile, but there is pleural thickening. There are other post-infectious changes around this cystic lesion or cavity. So it's not a simple cavity with a simple fungal ball. There are multiple cavities. One of them has a fungal ball, etc. Now, when all that CCPA involves more than 2 lobes is when you call it CFPA. So now it's becoming a little simpler, right? Single cavity with a fungal ball is just that, simple aspergilloma in a cavity. CCPA is when you have things like PTLD and then you have fungal ball in one of them, and then when you have that PTLD in multiple lobes and you have fungal balls in multiple lobes, like one here, or one here, then you call it CFPA, or chronic fibrosing pulmonary aspergillosis. CNPA is tough. For that, you have to have a CFPA first, and then within that, you would have a fungal ball, and then you'd have ground glass suggesting that there's some necrotizing component, and I find this a very tough diagnosis to make. So is aspergilloma nodule, because how do you diagnose it without a biopsy? Now, this patient who has a CCPA, we see another nodule, we assume this to be an aspergilloma nodule, but this doesn't make a lot of sense. So, frankly, I think the classification sucks a little and needs to be redone. And perhaps we should have more clarity about the definitions as well. And that's fine. I think this is a starting point to try and figure out whether these have prognostic significance or not. To some extent, they do. But I guess eventually in the next 3-4 years, we should have more clarity, and then I'll put that up. I'm not going anywhere. So, diagnostic criteria for CPA are 3 months of disease, typical CT appearance, direct evidence of aspergillus infection or immunological response, not immunocompromised, though you could have nutritional deficiencies, etc. These are the predisposing factors. You need a predisposing factor. It could be ILD, and we've seen fungal balls within the honeycomb cysts of ILD, and maybe I'll show that another time. In large bullae, bronchiectasis I showed you. In ABPA, you can have secondary fungal ball because you've got bronchiectasis there. And then in PTLD and similarly in sarcoidosis, if there's been a lot of fibrosis and cystic or cavitary change. Here's a patient who had a hydatid cyst. You can see the membranes here, who had the soft tissue that was mobile within, and this was a fungal ball. I had done a biopsy and I proved this. So there was a fungal ball within an old hydatid cavity. All of that can happen. So under the umbrella of CPA, which is chronic pulmonary aspergillosis, you have all of this. If you find that you're not able to figure out the difference, then when you're reporting, and the moment you see a fungal ball in a cavity, you could just report it as that, or you could call it chronic pulmonary aspergillosis and leave it at that and let other experts figure out what it fits into. So our patient had PTLD with CCPA, and this is the definition of CCPA, the commonest form of CPA, where you have one or more thick vault cavities with one or more fungal balls with pericavitary fibrosis and pleural thickening. Please don't forget the table of contents. That's the only way to navigate the site to know everything that is up. My WhatsApp channel, and for those of you like the other stuff that I do, this is what I did on Friday night, looking at this one article from the NEJM to see if even if you change your, control your blood pressure and stop smoking after the age of 55, does it make a difference? And yes, it does. That's the book, and this was the CT biopsy case. This is still an ongoing case at bstneoplasms.com, and I just put this up on Thursday, where we looked at acute infarcts and hemorrhage within them. You know where to comment, email, subscribe, etc. And thank you so much for listening to me. I'll see you in a couple of weeks now.